Okay, so this is an example of the otoscope that we're using in the department. So first things first, look over the top. So as you can see, there's examples of what you might find in a normal ear. A little cone of light, the reflection there. Also, if you might see an ear infection, and that's bulging that you might see, and redness that you might see, it's associated with usually with fluid. You can also see perforations that might occur from trauma, or maybe even an infection that got so bad that there was a spontaneous perforation. Or, especially with some kids, you're going to see these PE tubes. They're tubes that were placed in so that it can drain fluid and it could avoid more infections. So this is kind of what you might see. So look these over, and that's kind of what you might run into. Of course, you might see wax, and if you see a lot of wax, you just need to automatically not test them because they need to be referred. So this is what you do. You just open it up. And inside, you're going to find the otoscope. Pretty straightforward. And here's the specula, the tip. The tip you put on and you twist. Once you twist it, it won't come off. You untwist to pull it off. It's a little rigid. There you are. Okay, so that's it. And that's the otoscope. On the bottom, you're going to have the power button. And there it is right there. So as you can see pretty well inside with it, and I'll show you some of that in a minute. Don't forget to turn it off, throw away the specula, put it back in, you're all done. Okay, so this is when you're approaching the patient. You pull up on the ear, okay, you look in the external canal, and if there's something, if there's a blockage, or if there is flow of some kind of fluid, then clearly you're done. Okay, if not, pull up on the ear a little bit, keep your hand out a little bit, maybe your finger or something, so that if the patient moves towards you, they won't push themselves onto the specula and maybe hurt the canal. It won't go further enough to hurt anything else, but just in case. So keep your hand out a little bit and then look around inside, and then we'll talk about what you're going to find when you look in there, okay? But remember, pull on the canal a little bit so it straightens out. Check out the canal, but you keep your fingers out so that in case the patient moves, you don't hurt the canal. All right, so this is what you might find when you're in the canal. I'm using a camera so I can show you. So of course there's going to be some redness in the canal. It's no big deal, it's normal. And some wax, that's normal. Hairs, normal. As you look inside, you can see there's the eardrum, and the cone of light is that shiny white thing. And so you can see there's no bulging, no perforations, and that's all you're looking for. That's all you want to do is see there's nothing going on with the canal and no big blocks of wax. That's all.